So welcome everybody. Good afternoon. It's a glorious day outside, but I'm hoping we can provide you with some equally engaging entertainment and information in this session today, so you don't miss the wonderful weather. My name is Maroon Sisodia. I'm one of the co-chairs of the NNPCF, along with Tina Emery. So this is the second session, our second session of the day, and we're covering off on another one of our priorities and major areas of interest as parent care reforms and the NNPCF. We're going to talk about the long-term plan, the NHS Long-Term Plan, and in particular the Learning Disability and Autism Programme as a part of that today. So we're really fortunate in that we've got some great speakers from the NHS to come and talk to us about that. We were scheduled to have Tom Cahill, who is the new clinical director of autism, come and join us today, but unfortunately Tom has been pulled away to go and talk to the committee on children's human rights, which I'm sure you'll understand it's important he prioritises and makes our case there. So we've got a great session for you today, and with that, let me just quickly introduce our speakers. So we've got Luisa Stewart, who's the Director of Policy for Mental Health and Learning Disability and Autism. We've got Phil Brayshaw, who is the Acting Head of Children and Young People in the Learning Disability and Autism Programme, and Claire Dowling, who's the Director of the Autism Programme. And we're also joined by Steph, Cram and Ruth Atkins, who are participation managers at the NHS. So without any further ado, I'll hand over to Luisa, I think, is going first, and enjoy the session.
Thank you very much, and it is indeed me going first. And in time-honoured Zoom fashion, you've just missed my 9-year-old who's home with COVID, appearing briefly on screen behind me and running off again, I think just in time before I spoke up. So any apologies for any background introductions. Delighted to be here with you today. Sorry, Tom's very sorry he couldn't be, but I am also a very newly appointed Director of Policy for Mental Health, Learning Disability and Autism. So I hope you'll take me as a second. We've got a number of us from the team here today to talk you through. I'm going to kick us off with just a bit of an overview on the wider context, in particular about the NHS plan and what's happening before handing you over to colleagues to go through a little bit more of the detail. And I'm going to start with a quote from the long-term plan, which is very much the guiding principle for us in learning disability and autism program, and I know you can read, but I will read it out loud for any of you working from very small screens. And it's simply that, you know, together we will work to make sure that people with a learning disability and autistic people have longer, happier, healthier lives. Now, in terms of a programme, there are 6 underpinning elements to delivering this objective. So they're here on screen in front of you. They're around improving quality for those in hospital settings, a better start for children and young people, improving community provision, so we reduce the number of people in hospital, improving health outcomes and access to care, building a capable workforce, and improving services and outcomes for autistic people. And colleagues will shortly talk to you about some of the detail behind that. Before we do, and moving on, I just wanted to talk about what's happening in terms of the wider NHS. So the first key thing is that as an organisation as a whole, NHS England and Improvement has set the priorities for 22-23. For the NHS as a whole. These are the key areas listed on this slide. A lot is as you would expect, the kind of the response to COVID, the kind of investment in our workforce, the improving access to care, and you'll see written in bold is very much kind of one of the 10 priorities was improved mental health services and services for people with a learning disability and autistic people. And I just wanted to kind of set that in context, because I think it's important that you know that from the perspective of the NHS as a whole, that we are signalling the importance about that. And it's not just about improving mental health services and services for people with a learning disability and autistic people. It's also about improving the health outcomes more generally, not just our specific services, but also ensuring that other NHS services provide a better offer and outcomes for the people that we're concerned with. So this sets out our priorities for the coming year. We've also started looking beyond 22-23 and what happens next. I mean, as you're aware, we had the NHS Long-Term Plan. It was published in what feels like now a very different era, given that we've had the pandemic, which has had all sorts of repercussions, not just in terms of the health of people who are directly affected by COVID, but all of the lockdown and the restrictions and the impact on wider services to support people. And because of that, and also because the government has given us us, the NHS, an indication of our overall funding envelope for 24-25, we've been looking at the NHS long-term plan and are planning to update it, both to reflect the significant changes that have happened, but also to take it for an additional year up to 24-25. The other significant development that we've had, which is outlined next on the following slide, is how we've also got opportunities with the establishment of the 42 integrated care systems to join up care more, particularly across the NHS and across local authorities. We've got the legislation that is currently going through the Houses of Parliament that will put integrated care systems on a statutory footing. It'll create integrated care boards as new NHS bodies. They will be established from the 1st of July 2022. And I think particularly for for our programme on learning disabilities and autism, that join up across health and social care is absolutely critical. In terms of learning disabilities and autism and our programme, I mean, the impact of the pandemic, yes, it has disrupted services. It's also highlighted and exacerbated the health inequalities experienced by people with a learning disability and or autistic people. So what we're expecting to do as part of the refresh is to continue to emphasize and drive delivery on the commitments that were in the long-term plan. So we will continue to drive improvements in terms of reducing the reliance on mental health inpatient care. We'll continue to want to tackle health inequalities, particularly those experienced by autistic people, and the drive to address and reduce autism diagnosis waiting times in particular. We'll continue to have a renewed focus on learning disability annual health checks. We were delighted that last year in the pandemic we were still able to meet targets on that, but recognise that they're absolutely critical in terms of ensuring that the physical health outcomes for people with learning disabilities and autistic people need to be improved, particularly for children and young people and people from ethnic minority groups. We will be continuing work to include a reasonable adjustments digital flag. So that's within the patient record to have a digital flag where for GPs, so that where they have a patient with learning disabilities, that that they're aware and know that this person will need reasonable adjustments, but also particular support for their physical health outcomes. And then back to the point I was making on the last slide about the kind of the opportunity for further join up across health and social care, because it's absolutely critical that we work collaboratively. We will be coming out to do further engagement or as we refresh those plans, so we'll be in touch about that. And that is the kind of the general overview from me, broader context on what's happening across the NHS. And I'm going to hand to Phil next, who I believe is going to be the first of the colleagues to take you through some of our plans in further detail. Over to you, Phil.
Thank you very much, Louisa. Good afternoon, everybody. I'm Phil Brayshaw. I'm the Acting Head of Children and Young People on the Learning Disability and Autism Programme. And as I was looking at my notes and just kind of preparing what I was going to say, I thought I wish I'd put something of an introductory slide in before the next 4 slides that I'm going to talk through. Because what I would like people to do, or what I'd like to encourage people to do, is think about how all of these things link together, but also think about how together we can help to develop, shape and influence all of these pieces of work in their own right, and as they sit as part of a support offer for children, young people and their families. So the slide I would have put in would have said that I'm going to talk about identification and support. So that's how we know who children and young people are, where they are, what their needs are, and how we describe the support that we can offer them across the NHS and partner organisations. How we think about improving quality, how we think about improving health and special educational needs and disability. So those are the 4 slides that I'm going to talk through. The approach I've taken today is to list the different areas of work and just to say something about them. But as I say, I think there's something about how, I hope that the new part in this will be thinking about how all of these things connect and how we can help make those connections nationally, but also regionally and locally, working with colleagues in the national, in the network of parent carer forums. So the first thing that I want to talk about is the Dynamic Support Register. So the Dynamic Support Register is a way that local areas understand their population of children and young people. And that's by essentially creating a register that sits across health, social care and education that names those children and young people who are at risk of admission to mental health hospital. So that's a really good indicator of crisis. But also lists those children and young people who will become at risk of admission unless we do something together and do something quickly. And so that's about describing the support that goes alongside that. There are a couple of new things that we're introducing in guidance that we're going to publish in a couple of months' time. That again, I would encourage people on this call to think about, because I think it's where we're going to be looking for support and influence from children and young people themselves, parent carers and other unpaid carers. And that's something about how you could self-refer onto a register. So how you could approach the person that's holding the register in your local area and say, actually, I think I need the support. So it's how we work with, how we work together to make sense of that. So that children, young people and families can say, these are my needs and I need you to listen to them in a different way and with kindness. And there's also something about how this links to the key worker offer, which again is on this list. So there's something around, we're introducing some new asks into local areas, and how can we do that in a way that's sensible and meaningful for yourselves and your families. Care education treatment reviews. There's also a right to request a community care education treatment review, and we need to make sense of those 2 things together. So for those of you who have not come across care education treatment reviews, this is a way of bringing together health, education and social care along with independent experts and experts by experience to determine if a hospital admission would be the right course of action for your child. And additionally, looking at what type of community support would be most useful if not. The next bit that I've linked onto that is developing community support and services. So we've made some considerable investment over the last year and continue to do so as part of long-term plan investment over the next 2 years in terms of developing intensive and enhanced support. So particularly around crisis. And so there's something around if through a dynamic support register, we understand that a child has some additional needs that needs some additional support. If a community care education and treatment reviews helps us to describe what that is, then that service has to be available in your local area. So there's something around where are the gaps in services locally? What might that look like? And so the types of things that we're looking to develop are things from crisis cafes to support mental health to overnight short breaks or emergency respite care and how we might develop that. And there's a whole range of work going on around that. And then the other thing that I've chosen to include on this slide is key working. So when we identify a child at risk of admission, there will be offered a key worker. There will be a key worker offer in every local area across England by the end of this year, this financial year. And so how does a key worker help children, young people and their families make sense of what's on offer locally across voluntary sector, support from organisations such as yours, from health education and social care. And so there's something about how do these move from being separate pieces of work and separate offers across the long-term plan to be part of the support and service offer to children and young people and families locally. And I think that the ask again is to really think about how these link together, but also to think about how we can work with the parent carer forums and with your regional and national colleagues to really think about how this forms an offer that makes sense locally, how these things connect, how these things become really meaningful, because we're seeing where these things are in place, that children, young people and their families have better outcomes across the board and are much less likely to be inappropriately admitted to hospital. So the next slide, the one that we're on, thank you, is around improving quality. And this is about making sure that children and young people are safe in our services, that the care and treatment they receive is effective, and that children, young people and families have a good experience of care. I've listed a number of projects. Again, they connect with each other. They're about improving care for the individual through care education treatment reviews, really understanding what children, young people and families' needs are. Reducing restrictive practice. So we're doing a lot of work with colleagues in mental health, inpatient services around reducing the need for physical intervention, for using seclusion, segregation through offering much better adjusted services. There's a piece of work around escalation and length of stay. So where it's not working for a child in our care, we quickly understand that at both the regional and national level, and we can offer a timely response. And then improving quality of inpatient services, thinking about the environment, thinking about the workforce, the training of the staff. And then the last thing, again, about improving experience of care is a purple book. And so that's a person health record, rooted as an idea in the Red Book in early years. So a person would hold their own record of different services and support they're receiving to make sure that families only need to tell their story once, and that's shared in an appropriate way. So that's improving quality. Improving health. So there are three main strands to this, sitting with the programme. The first is around introducing sensory checks in residential special schools. And by that, we're talking about hearing, eyesight and dental checks for all children in residential special schools to make sure that those essential needs are being met. The next part of our work in terms of improving health is to make sure that we deliver on the commitments of the long-term plan, and those commitments that are all age, so that we think about how we offer annual health checks to children 14 plus, how through Stomp Stamp we make sure that children and young people are on the right types of medication at the right level for the right amount of time. And then also the leader work in terms of learning from deaths, in terms of health inequalities, how we might address them. The third part I've included on this slide is around how we can ensure equal access to, experience of and outcomes from all NHS services. So this speaks to reasonable adjustments, including the red flag that Luisa mentioned, in terms of understanding when a child or their family have additional needs, that services are aware of that and respond appropriately. So again, there's something to think about how we can help shape and influence all of those things. The fourth slide is around special education needs and disability. This is the work that our colleague Lorraine Mulroney leads on. I know that Lorraine's going to be offering further sessions as we understand more about the implications of the SEND reform. So I'm not intending to go into too much detail around this. Other than to say that we're working with across government departments to make sure that health is well considered in the reviews, and we're going to continue to work with them nationally, but also work with colleagues regionally and locally to make sure that there's a really good health offer in place for children and young people with special educational needs and disability as part of that broader offer. I've named a few things that Lorraine's taking forward. I'm absolutely sure that Lorraine will come and talk to you in more detail around this. But things around making sure that health needs are really well included in the inspection framework, making sure that local areas respond to feedback from those inspections, making sure that there's SEND leadership, particularly at a regional level, to make sure that local areas are doing what they need to do. And finally, and just to name this really, the work that we're doing in terms of improving a response from therapies. Again, as Luisa touched on, thinking about what that means in a post-COVID environment and access to speech and language, occupational therapy, physiotherapy, and other community services. So that's a whirlwind kind of tour of the work that we're doing. Wanted to share the kind of breadth of the scope of the work, and hopefully it demonstrates a real commitment to improve the offer in terms of supporting a crisis, reducing inappropriate hospital admissions, making sure what we do is safe and effective, making sure that people have a good experience of it, making sure that health needs are met as well as mental health needs. So thinking about physical health needs and making sure that we meet our responsibilities through SEND. So that's the work. Before I hand over to Claire, I would just share that we're having conversations with the national network, with Marunal and colleagues, around how at a national level we can think about how we frame some of this work. And we're also thinking about how regional colleagues can have meaningfully work together with regional parent carer forum colleagues. And also then we need to think about how every local parent carer forum can be meaningfully involved in this work, in terms of making sense of this work. Because whenever I talk about any element of this, one of the key points I make to colleagues in services is that when we're trying to do this at a local level, unless we are talking to parent carer forums, unless we're talking to and making sure we include the voice of the child or young person as well, we are not going to deliver this in a way that's helpful. We are not going to deliver this in a way that makes sense to families. And so that's the final thing. And just to end, I was on a call with parent-carer colleagues earlier this week, and there was a line around parent-carer forums that are often used as a tick box for participation by commissioners or by local authorities. And I just wanted to share our commitment to get beyond that, to make sure that the things that we do develop as a result of the long-term plan are co-produced, have a good level of participation and make sense to people. Hope that that's helpful, and I will hand over to my colleague Claire.
Thank you, Phil. I'm not sure whether people can see me. I'm not sure whether I've got a technical challenge going on, but can you hear me?
We can see and hear you, Claire. Keep going.
Oh, you can see and hear me. Okay, that's great. Thank you. So thank you, everyone. And just to give a slight bit more context behind what Phil was talking about. We get a lot of questions about how do the Children and Young People's team under the Learning Disability and Autism programme liaise or work with the autism programme. So just to give you a bit of reassurance that Phil and I work very, very closely together on ensuring that we can maximise the amount of work that we can do within our kind of different programs, but it's definitely not duplicating, it's definitely complementing. So the other thing I'd just like to add is a big thank you to the NNPCF for being our key partner across the programme, for helping us form our priorities and contribute to the long-term plan. So it was just a big thank you from the rest of the programme to you. So I am Claire Dowling. I'm the Programme Director for the Autism Programme, which was established in March 2020, just before COVID hit. But what I wanted to do today was just kind of give you an overview of the progress that we have made to date. Of course, our key objective is for improving services and outcomes for autistic people. And in establishing the programme, we actually have focused in on 3 different areas of work. The first one being around improving quality and access to diagnostic services, and also looking at the pre and post diagnostic support offer. As a programme, we have invested and commissioned quite a lot of research to help inform our thinking, and the RIAS project, which is done with Newcastle University and Sussex Foundation Trust, has reviewed all of the child and young people's diagnostic services across the country to find out what good quality looks like, to look at all the different variations in diagnostic services, but also to find out what is the optimal model to give the best outcome for autistic children, young people and adults. We've also been working with Jonathan Green in Greater Manchester, Professor Jonathan Green, who has also this week or next week in Autism Acceptance Week, going to be publishing some new research on psychoeducational interventions for autistic adolescents. So all of that kind of work helps inform changes to the diagnostic pathways. We've also worked through this last year to encourage local systems to innovate and develop best practice pathways, and we have tested out new approaches for triage and developed pre and post diagnostic support offers, as well as trialling needs-led assessment. This coming year, we will then use that as a kind of baseline on how we will move forward with Diagnostic Pathways. We've engaged with families and carers and clinicians to agree 5 main components of the diagnostic pathway. We've informed our understanding of the location and makeup of the different specialist autism teams, and we're currently looking at the training and workforce needs for the future. And we're also working with HEE, Health Education England and partners to develop autism training and education and awareness. And all of this helps inform our work going forward to develop a diagnostic service specification and supporting documents in collaboration with NICE. We've also worked with Contact, who have we commissioned a report through Contact and received outlining the feedback from families and carers in a workshop in November. And we've also worked really tirelessly behind the scenes to improve our informatics and data, to improve the data quality and completeness so that we can accurately record diagnostic waiting times. So in this next year for this work stream, we will continue to work with and embed the views of families and carers in the programme. We will continue to use research evidence to inform the work stream and the diagnostic pathway itself. And we will also develop a service specification and supporting documentation. We are also focusing on transitions between 18 and 25. So that's work stream 1. In work stream 2, we have very much looked at improving, reducing health inequalities. And what we have done is commission some work with Newcastle University on an autism specific health check. And that is currently being piloted in the North region at the moment. And we will look to extend those pilots wider. We're looking to understand how we can fund the longer term rollout of this and ensure that GPs can identify autistic people so that we can ensure that they're included in an annual health check. We have also been included in the LEADER programme, LEADER meaning Learning from Lives and Deaths, and for the first time. So we will be able to look at and get thematic analysis on how to improve or reduce health inequalities. We supported some research in Plymouth University to interpret the results of some experimental analysis on autistic people's morbidity and mortality. And we're also working with the National Autistic Society to understand the more underrepresented groups in autism specific registers. So that is work stream 2. And then work stream 3 is very much around, next slide please, thanks. Work stream 3 is very much around improving the quality of and access to mental health inpatient settings to support autistic people. We've done a lot of work in this space over the last year, specifically looking at improving sensory and social environments for autistic people. We've commissioned NDTI to develop the 10 sensory principles that was published in It's Not Rocket Science. We are also amending the Green Light Toolkit currently, but that is another audit tool that can be used by mental health services to look at areas that can be adjusted for autistic people. We have also supported some research from Reading University on developing a sensory app, and this has also had autistic people working with Reading University to kind of co-produce what that app would look like and how we would use it. Our other priority in this work stream has been about improving clinical leadership and fostering a culture of improvement. And we've been working with a number of projects across the programme, one being HOPES, the other is in reviewing the CTR policy, and as Phil has said, the delivery of the dynamic support registers. We've also been supporting the safe and wellbeing reviews and focused on supporting discharge and improvements in services, looking at the thematic challenges that have come out from those reviews. We've also been monitoring the success of learning disability and autism champions that have been put into each integrated care system, and they will help support us with our planning and priorities for next year. And of course, all of this is around listening and embedding the views of people with lived experience. And we have worked through patients and families and carers on developing the sensory environments, the sensory environment work, on developing the diagnostic pathway work, and they will continue to support us on developing the priorities going forward into 2022. And I think continuing engagement with lived experience forums as well. The final part is around improving the workforce training and professional development. And we're doing a lot of work in this space at the moment. We intend to invest in a significant amount in autism training and education and improving awareness so that we can attract, grow and retain the workforce, the autism workforce, but especially the specialist autism teams for the diagnostic pathway. We have commissioned some tier 3 training in inpatient settings that complements the children and young people's tier 3 training done by the Equality Task Force last year, and we intend to expand those into community services in 2022. That's us working in partnership with South London and Maudsley Foundation Trust and Anna Freud, as well as using an evaluation partner, which is the National Collaborating Centre for Mental Health. We currently have 330 subject experts trained for the tier 3 training. We have 50 experts by experience trained by the end of March, and we have 48 settings that are engaged in the work that we're doing around tier 3 training at the moment. Our future kind of training plans are around looking at consultant practice, autism advanced practice, peer support workers, peer education, peer leadership, and exploring the skills of the specialist autism team. So I'm really hoping that perhaps if I return this time next year, we'll be able to tell you all the work that has happened within the training and educational space. I think the future work, obviously we will be working with our cross-agency, cross-government colleagues on delivering Oliver McGowan training and looking at autism nurse development, employing autistic people and supporting internships. I'm attracting autistic people to healthcare, support worker roles, and developing a bank of experts by experience that can help us deliver and implement all the changes that are currently in train. I think that's me, if that's all right.
Great, thank you both, Claire and Claire, Laura, and Phil. We've got a little pause here for some questions. What I might do, if it's okay, there's a few questions that were popped into the chat as we were going through. I might just play some of those back to you, and if anybody else does have any other questions, please pop them into the chat and we'll do our best. If it's okay, timing wise, we'll spend about 5 to 10 minutes on just taking some questions, if that's okay with you, Claire and Phil. Yeah, so you're nodding. Great. So the first question just that I noted was health checks in residential settings. A lot of enthusiasm for that. Can you say a little bit about the rollout of that beyond residential special school settings?
I'm not sure that I can, to be honest, Marudel. I know that at the moment we're looking at the delivering against long-term plan commitment, which is around making sure that those children in residential schools have access to those checks. I know that there's been some proof of concept work in special day schools, but I'm not sure what the future intentions are around that. I mean, that is something that we could certainly come back to you with, Marudel.
Thank you. Yes, and my understanding is that the intention was always to start in these settings and then look at further extension after that, which I think tallies with what you just said, Phil. There's a question in the chat around a comment I think you made, Claire, around GPs diagnosing autism, the role of GPs in diagnosing autism, and just really as to whether, to the extent that many families have quite traumatic experiences with GPs, the first port of call. And I think there's perhaps underpinning the question was perhaps the question was actually about training for GPs to enable them to do this and take a greater role in this. Can you say a little bit more about that?
I can. And a slight nuance. So it's not the intention for GPs to diagnose autism. Firstly, to say that the intention is that a specialist autism team will diagnose your child, young person, or an adult with autism. The intention, though, is that we train GPs to be able to work with autistic people on ensuring that they are physically well and that they have appropriate health checks in primary care to ensure that there are no other underlying morbidities or challenges for individuals. The challenge we've got is that the annual health checks as they currently stand is only for learning disability and learning disability in autism. It's not for autistic only individuals. And so what we need to do is create a way in which we can get GPs to identify those autism only individuals so that they can have that health check in primary care. But there is no way we will be asking GPs to do diagnostic work.
Thank you for clearing that up, Claire. There's just a little bit of misunderstanding what you said there. Just a couple of questions have come into the chat. One from Phil, from Buckinghamshire, one from Anchor, from East Riding, and if I might just knit the two together and develop a theme. One of the things that we are getting, perhaps the biggest single issue that we are hearing from parent care reforms at the moment is around very, very extensive delays to community services. These were in existence before COVID, and following on from COVID, that certainly hasn't helped because you've layered on greater demand and a backlog to those delays as well. So we're talking about some areas are talking about, not unusual to hear about 18-month delays for autism diagnosis. In some areas are talking about 4 years, and God forbid, I even heard of one area talking about 10 years the other day. So there's clearly something around workforce there, and there's clearly something around the structuring of services. Can you say a little bit about what you are doing in order to meet that demand in autism services, and how, the steps you're taking to address that?
I can. So first of all, we all recognise the shortfall in the workforce across autism. I'm looking at some answers or questions in the chat around therapists, and we're very, very clear that in order to meet the demands for diagnostic assessment, we have to, well, to develop specialist autism teams, we have to grow the workforce for autism. And that is something that is very, very much at the forefront of our conversations around that. I think the other challenge that we have got, which is probably not visible to you, is the challenge we got between training that workforce and then that workforce being attracted by private providers. And sometimes that's very difficult for us, because what we're trying to do internally at the moment is agree the best pathway for young children, so 0 to 6 year olds, because they enter through paediatric community services, through the kind of 7 to 14 year olds, and then for 14 and above adult services. We're trying to reduce the variation, trying to agree the assessments needed, what that pre-diagnostic support offer should be, what that post-diagnostic support offer should be. But what we're finding is that private providers don't necessarily have that, and a lot of people are attracted by, obviously, attracted outside the NHS. So we need to be able to grow our workforce and support our workforce in developing best practice services in the NHS. And then looking at the waiting list to remove the kind of waiting lists from a kind of operational perspective. But it's really important that the pathway that we put in place is of high quality. So if I give you an example, Jonathan Green's work that's being published next week as under our Autism Acceptance Week is around pre-diagnostic support and psychoeducation for families. And what that has shown is that in the trials that he's had done is that a lot of families, because they had that pre-diagnostic support, were in less of a rush to get to that diagnosis point, assessment point, because they felt supported and they felt as though it was so actually waiting 18 months or whatever, if you're properly supported, is not as bad as having no support at all at the pre or post diagnostic element. So there are lots of components to this that we want to try and get right.
So thank you for that. I'm very mindful of time, so I'm gonna move us on and bring Steph and Ruth in. But just to pick on a couple of themes that we've touched on in this conversation. I think just to let our members know, we've arranged. We're working with Lorraine Moroney, who is the SEND program lead for NHS England, to come and do a webinar for us, likely to be in early June, around the response that the health service in total is, the way in which the health service in total is responding to this huge increase in demand and this increase in waiting times. So Lorraine, I understand that some conversations are taking place at a very senior level in both the NHS and the Department for Health and Social Care around this topic. It has been escalated, it has been understood, and Lorraine's going to come back and share some of the work that's being done to try and address that issue. Some conversations in the chat around equity of services, or a postcode lottery essentially, and if you listen to what Minister Quint said this morning around greater standardization of services across the country, coming as a part of the SEND review, and also if you listen in tomorrow to what the NNPCF, what we're going to be sharing around what we've asked for from the SEND review, I think that might go some way to addressing those concerns. But what I'll do is I'll draw a close on the chat at this stage and then pass over to Steph and Ruth But bear in mind, we will have an opportunity to revisit this when Lorraine comes and does her webinar to us in June. Look out for details for that.
All right.
Thank you very much. Hi everyone. Thank you very much for the opportunity to speak today. I'm Steph and I'm a Public Participation Manager from the National Public Participation Team. And I'm here with my colleague Ruth Atkins to tell you a little bit more about the new Integrated Care System-wide guidance that's going to be published in the next few months on working with people and communities. I'm going to try and present for about 10 minutes and then leave a bit of time at the end for any questions and comments that you might have. I'm going to present, Ruth's going to keep an eye on the chat. If you do have anything as I'm going through, feel free to drop any comments or questions in there and we will come back to you at the end. So in terms of, if we just go along, talked about the purpose of the session and along again. Thank you. So yeah, 10 minutes, then 5 minutes, and then yeah, I can chat to you about what the guidance says. So essentially, and specifically for this group, what's been quite interesting about the new legislation that's come out around ICSs is that this time it has made specific reference to carers. So in the past, in terms of working with people and communities and engagement, the legislation has just talked about service users and their relatives, and so that's a key change. Before I talk through this slide, just to say that the guidance in itself, it's going to be policy for NHS England to follow, and it's going to be statutory guidance for integrated care boards and NHS trusts and foundation trusts. So what we mean by statutory guidance is basically that we would expect those groups to follow the guidance, but where they don't, for whatever reason, they need to be able to provide a reason why they've kind of gone against the guidance. And so the guidance as a whole talks about this idea of working with people and communities, and that term itself is born out of a lot of different pieces of language that is often used around engagement. We feel like there's a lot of buzzwords, and we've been told that by the people in the co-production group that we've been working with, that things like engagement, participation, involvement, co-production, they're all words that are used a lot and a lot of the time in different contexts. And so what this guidance focuses on is looking at all of those different things, but under the umbrella term of working with people and communities. So this slide that we've got up on at the moment just talks about the different ways in which you can work with people and communities. And working well with people and communities could involve one of those petals on the diagram or a combination of a few. So we've got things like co-production, communicate, consult with the public, co-design, for example. And there are different situations where they may be needed and where some might not be. So moving on, I just want to talk really briefly about why we might work with people and communities. So I'm not going to spend loads of time on this because I think this group is probably aware of the benefits of doing that. But just to say briefly that we do really believe that people and communities are where all of the experience and skills lie. And that there's insight there to be able to transform the way we work in healthcare, and working with people and communities in meaningful partnerships really is essential to what we do, and not merely something that might be optional or desirable. And so the expectation is that health and care systems really need to build a positive and productive relationship with communities to improve services, support and the outcomes of people. I have mentioned legal duties already, but that is something that is another reason why we have to do that. So there is kind of legal duties around that for NHS England and statutory responsibilities for others. So I'm just going to give you a quick reminder of the new legislation. So the February 2021 white paper proposed this legislation, and that was to really underpin the move towards integration, which is all in line with the long-term plan. The new Health and Care Act is due to come into force in July 2022. And there's a huge emphasis on integration within the NHS and between the NHS and other partners. So I'm not going to go into detail on this, but this slide here just gives the roles of the different parts of the ICS. I can see a few people asking about slides, and we will share those afterwards. But this just gives you a bit of a breakdown about the roles of the ICBs and the ICPs and what they all do. If we can just jump ahead, and jump ahead again, please, because that just covers what I've just said. This table is also quite an interesting one. So this talks about the participation responsibilities at each different level. And so for the integrated care boards, they have to involve people and communities in the planning of services and the proposals and any decisions that are being made around that might impact the service. For the integrated care partnerships, they'll be responsible for developing the integrated care strategies. The place-based partnerships will fully engage with those affected by the decisions. So that's kind of more at a local level. And then your provider collaboratives look to really share and build on good practice. So they would be perhaps working with partners like Healthwatch or local authorities, that type of thing. So the scope of the guidance, it's looking to replace the September 2021 support guidance, which if you haven't seen and you'd like to, just give us a shout and we can share the link for that. So the basis of NHS England's assurance and the ICP involvement duties, and it will also be good practice for other organisations within or who partner with the ICS to follow. So within the guidance, there's 10 main principles that I've got on the next slide, which basically just talk through what we would expect people to consider when working with people and communities. The guidance itself goes into a lot more detail about how you might do these steps or what the challenges are and how to overcome them. But some of the things on there are aiming to put people at the centre of any decision making that's going on at every level within the ICS. A real highlight to start engagement early. I think another speaker mentioned this kind of idea of a tick box, and we really want to move away from that in terms of working with people and communities into something that is thought of at a really early stage. And also a highlight on building relationships with more excluded groups, so especially those affected by inequalities. So the guidance itself is going to consultation in the next few weeks, sorry. And what that means is that a draft, oh, I've lost my slides. I'll keep going about the consultation. So the consultation will be going out in a few weeks, and what that means is that it will give the public an opportunity to comment on the draft guidance. So just to make it really clear that we are at a draft stage at the moment, and what we want to do is share that draft with you. And there's a survey attached to that, and what it means is that you'll have a chance to comment on anything that you feel like we've missed, anything that doesn't quite sit right with you, and then we're able to take it from there and make changes. We will be able to let this group know when that consultation has started. We're aiming.
This meeting is being recorded.
Perfect, I think we're back. And so, yeah, what will happen after people have given their feedback is that we'll produce a report, and on that report, we'll be able to give a bit of a summary of the survey results, let you know what people have said and how we've actioned that within the guidance. And then if there are any comments where we've either decided to do something different, then that'll give us an opportunity to tell you that and give you a reason for that. Brilliant, thank you. So yeah, like I said, next few weeks will be the public consultation. And then after we've taken in all those comments, then we're hoping to publish the guidance in the summer. And that will be after the legislation is officially officially out, and that will be subject to approvals. I realise that's probably quite a lot of information to take in at once. I don't know, I'll have a quick look through the chat now, but it would be really great to hear your initial thoughts on this, if you already have initial comments or questions. And yeah, if we can't answer them now, mine and Ruth's email addresses on the slides, which will be shared with you. Please feel free to drop any comments to us, or if you need anything clarifying, happy to do that as well.
Yes, Steph, can you hear me?
I can, Ruth. Hi.
Yeah, it's just I'm in on the chat, and Polly asked, does the term communities include schools? And I've said yes. And she has said that they're not specifically mentioned in the 10 principles. So that's the sort of thing, Polly, that when the document comes out for consultation would be really good to have. We'll feed this back as well, but it'd be really good to have a chance to for you to add that sort of response in.
Okay, thanks.
And also, Karen, I've picked up our experiences at the CCG only want to engage with individual patients rather than parent forum, and concerns our voice will be more diluted with the introduction of the ICS. Michelle's on the call, and the reason I'm saying that is because I worked with the previous Swindon Send Families Voice Chair, Jackie, and I think well, I'm going to be biased in what I'm saying, but they had a really good model there going with the local authority and the clinical commissioning group on how we did link with the local group and not just individuals. So Karen, if that can be picked up away from the meeting, I don't know how you want that done, because I'm sure Michelle would share with you what's going on in Swindon. Yeah, and she's put that as well.
That would be really helpful. And I think one thing we're really trying to do with the guidance is build case studies that will really bring the guidance to life. And so if you do have any examples of where engagement with the Carers Network has worked really well, then that would be an opportunity to get in contact with us, and we can build a case study into the guidance so that there is more of a focus on that. Thanks, Ruth, and thanks, Michelle and Karen.
Just whilst people are perhaps putting a few comments in the chat, could I just pick up on a theme around the you know, something that Phil mentioned earlier, something that we're very hot on, is where do parent care reforms fit in this engagement, in this co-production piece? Because at the moment, with the system in flux, it's quite clear that you know, parent care reforms won't be getting a place on ICBs, the integrated care boards. The membership of that is very limited, and also it is numerically limited as well. But do you see parent care reforms working with the ICPs, the care partnerships, and do you see them, and how is engagement going to work at a place level? If any sort of steer or any guidance you can give our membership of how to effectively engage in this new and changing system would be very welcome.
Thank you. I think that's a really big question, and it probably needs quite a lot of unpicking. If anyone has any thoughts on that, then we'd really welcome it. And I think that's what the case studies are looking to do as well. So speaking to where it's working really well and then building on that. In terms of the engagement that we've had with carers in kind of the production of this first draft of the guidance, we've been working closely with the NHS Citizens Advisory Group, and there are carers who are represented on those groups, and also the Learning Disability and Autism Advisory Group. But I think that's probably something that's going to be worked out as this guidance develops. And we can definitely add in different sections after the consultation if people do have ideas about where that would work really well.
Michelle, and it's Ruth here. Michelle, I've put a note here to contact you, because I think the example for Swindon Send Families Voice could be a really good case study. And I think demonstrate and show others the involvement, engagement with different organisations at a locality level as well.
Thanks, Ruth. I can see Phil's comment as well about the guidance needing to be explicit that PCFs must co-produce all services for children and young people with SEND. I've got a note of that one as well, so I can feed that back. Thank you.
So the public consultation is about to launch, and
Yeah.
what I suggest we do, what we will do is certainly Steph and Ruth, perhaps we could put you in contact with our policy lead at the NNPCF who responds to all of our consultations, and we will certainly, it'd be great to have a conversation with you and work with you to input some of these points that are being made in the chat and others directly to you. We will of course respond to the consultation formally as well, but perhaps we could follow up afterwards and just take that forward. And I think just to leave it a point to leave, you know, Steph and Ruth have very kindly given us their email address on the next slide. But please, I'd urge everybody on this call and parent care forums to respond to the consultation.
Yes, please.
Thank you very much.
Yes, thank you for letting us have your time.
Brilliant. Thank you, guys. So we've had quite an overview there of different things that are going on in the health service, everything from an overview of the learning disability and autism programme to what's happening with the health and care bill, to very specifically the area, the new requirements for engagement that are in draft guidance at the moment. So thank you to Luisa, Phil, Claire, Steph and Ruth for taking the time out to speak to us today. I think that's been a really interesting session. A number of the themes that we've picked up on today, particularly around the postcode lottery of services, particularly around things such as the long waits for services and then the development of future services, are going to be picked up. We'll be talking to a little bit more tomorrow as well in our session tomorrow afternoon on the NNPCF response to or input into the SEND review and the SEND green paper. And I think also Minister Quince picked up on some of those themes this morning in his speech to us. So hopefully it'll all knit together for us. But thank you again to our speakers. Thank you again to everybody who's given up a glorious afternoon to sit in front of a computer screen to listen to this. And we will see you again later this evening for another session, which I believe is about equality and diversity. And we will continue our programme then and also into tomorrow. So
Thank you very much.
Thank you.